Unilateral short leg. If it is emergency and acute sort of things, you exclude initially the septic arthritis, osteomyelitis, and fracture. If it is since birth, you consider the developmental dysplasia of hip. If it is a little bit later age presentation, the 4 to 10 years or so, you consider leg curve disease. The other diseases that can cause unilateral shortening of the leg, is slip capital femoral epiphysis, your complete segment, femoral shorten and short femur, post-traumatic, osteomyelitic sequelae, cerebral palsy, and polio once upon a time common in this part of the world, and scoliosis. And by far the commonest is transient synovitis, viral infection causing a little bit limping and shorten leg little bit. So in the by far the commonest is the development dysplasia of hip. It is basically a shallow or unstable hip socket. So if it is 0 to 6 months, up to 6 months, it is to be treated with a splint or bracing. Then onwards, up to 12 months, you need to have close reduction. And afterwards, followed by a cast. Afterwards, after 2 years or so, you could go for open reduction. And leg cup this presentation is little bit of late pain, limp, relating to the groin. X-rays diagnostic both the leg cup this and then your development dysplasia of a hip. So they are to be managed leg cup this managed in conservatively by a splint, painkiller, and your petri cast, long leg cast, something. Rarely you do need to have surgery for those cases. Refer those cases to your orthopedician.